So short answer, yes, you can still acquire long COVID, but your risk is reduced down by half. And I suspect it's going to be milder, hopefully, compared to someone who's not vaccinated. Yes, you can go away eventually. I do have people who snapped out of long COVID. And this is the most encouraging thing which the doctor hoped for. They come back, we congratulate the patient, the person is out of long COVID. The answer is yes. Asymptomatic COVID patients may suffer from long COVID too. But we don't know the figures. It's a bit hard to document all these. Because besides asymptomatic COVID, you could have other viral infections. There are so many other viruses happening at the same time. The answer is no. You do not have enough antibodies to protect yourself. You see, the vaccine that was developed in last year was designed against the original strain. Since then, it has mutated. So in terms of your B-cell matching, your B-cell matching is not good enough. You will get infected with COVID-19. You will. Since the virus has been mutated, the vaccine is less effective, you will fall sick with infection. So I'm going to predict that you will fall sick, but you're going to end up with mild disease or asymptomatic disease, and life goes on as it is.